This is going to be a brief section about growth differences, SGA and LGA. SGA is small for gestational age. So we expect preemies to be small and we expect full-term babies to be average size. But when they actually look at gestational age for each infant and at the size, and we compare the size to the average size for that gestational age. So every baby is evaluated for this. And if a baby is smaller than expected for their gestational age, we want to look at the reasons. Sometimes they just have small parents. Small people have small kids. Sometimes it's related to poor perfusion in utero, intrauterine growth restriction. Remember, we talked about that during pregnancy. And then those babies that have IUGR are more likely to have complications in labor because the placenta is not perfusing well. Well, they may also be born small. Now, poor perfusion can actually lead to accelerated lung development. So sometimes those tiny babies that have barely gotten enough to get by through the pregnancy and delivery, they may have less respiratory distress syndrome. But if it is poor enough to cause chronic oligohydramnios, they don't have enough fluid long-term, then it can actually affect lung development. If there's not enough amniotic fluid for a long period of the pregnancy, the lungs don't develop as well. It's called pulmonary hypoplasia. Babies that are SGA have a greater risk of hypoglycemia and temperature instability. Other than that, we're looking at what may have caused it. Any complications besides that may be based on what caused it. When you think about symmetric versus asymmetric IUGR, we always like things to be symmetrical. So we think that a baby that is symmetrically IUGR or SGA is probably better than one that is asymmetric, but the opposite is actually true. Asymmetric IUGR, usually the head is larger in comparison to the rest of the body because the head gets preferential treatment when it comes to circulation. With symmetric, the baby looks more symmetrical. They just look miniaturized, and that means the whole baby was getting inadequate perfusion. Asymmetric tends to be associated with temporary with decreased perfusion. Symmetric tends to be associated with some more complex genetic or chromosomal issues. LGA is large for gestational age. And again, this may be because the parents are big. Big people make big babies. It may also be related to diabetes. In twins, it can be a symptom of twin-twin transfusion. If you have one twin that's large and one twin that's small, you need to evaluate both of them because they may have, if they shared a placenta, one twin may have gotten more than their share of perfusion. If this baby is born to a mother with diabetes, diabetes slows lung development. So they're more at risk for respiratory distress syndrome, and they're more at risk for hypoglycemia. Okay. Again, what we're looking at, we can have a baby that is premature and also LGA. Okay, baby's born at 35 weeks, but they're the size of a baby at 40 weeks. They may be large for gestational age and be premature. And so then they may have the problems of both. So I want you to separate. We know that that gestational age is a factor in size, but I want you to separate those somewhat for this consideration. Next, we'll start talking about birth injuries.